really everything is new, everything's stronger, faster, quicker, and we have much more options of working, which makes the for laser experts, it's like a heaven. So we're going to start, and I'm going to go over the advantages of the device, and I'm going to spice it up with a little bit of my experience. And I hope we have some of practitioners that are already working with the devices and they will learn a little bit. And for those who are not, it's going to give them the motivation to start working with Alma. So I'm Dr. Lee. I'm a PhD in chemistry. I'm the VP Clinical and Business Development in Alma IL for almost 10 years. Under my supervision is all the training for Alma Israel, and also I'm a global trainer. I have lots of training with Adas abroad, and I'm really enjoying it to get to know other physicians and other technique. So again, thank you, Portugal, for the invitation. And we're going to start a quick overview of skin aging through my eyes, because I'm also training combination with injectables and with all the regenerative medicine era that started together with the energy-based devices. There's a little of maybe new perception on skin aging. So we all know the regular model that we need to pay attention to all the layers, starting from the bone, then going through muscles, fat, skin, everything. We need to pay attention to every anatomical layer. We know that the focus lately ran over muscles as well, with botulinum toxin started to be injected not only in the upper third of the face, but also in other areas. We know that we need to pay attention to the fat pads in the face and to have maintenance of them. And we know that talking about skin, we need to take care of our cells in order to let them to function better. I mean, a few years ago, we talked about biostimulation alone. We talked about collagen and elastin and the component of the skin that we need them in order to keep our skin young and healthy. Today, we're changing the concept. The concept is treating the functionality of the cells instead of the ingredients that it produces. And by having more and more treatments of energy-based devices technologies, together with regenerative medicine and the combination of lasers together with IPL and together with injectables, we can have the best treatments for a better skin and a younger skin. So, of course, we all know the targets of energy-based devices, indications, vascular lesions, pigmented lesions, tattoo, hair removal, skin rejuvenation. Each and every one of them is an ocean. We have so many options treating different indications, and sometimes even off-label. We know, once we're familiar with our handpieces and our technologies, we know we can assist situations that are not indicated especially for this handpiece, but we know a combination with this one would be helpful for this patient. So sometimes we start dancing with the handpieces in the edges of the scale. And this is when I appreciate the learning and education around laser basics, because this is what gives us the opportunity to touch these cases. So as I said, the regenerative medicine take place in our medicine, in the aesthetic medicine field, and we all working on the senescent cells of having, we're like breaking the process. We're trying to understand how to make them work better. And we try to pay attention to the fibroblast actions and the keratinocyte actions, and also that adipocyte. We want them to be viable. We don't want them to dissolve early in the face, in the facial area. So through energy-based devices process, we understand today that we can also control the process of wound healing and have it more through inflammation stage or less through inflammation stage. And I want to take you through the technologies and to make you understand how to combine it once you're keeping the aging scale really normal. And this is the treatment that I appreciate best. So this scale you are all familiar with. We're talking about the spectrum of light. We're having the visible spectrum, then we have the non-visible spectrum, and we have lots of wavelength. And what's important, it's all in our head. We're targeting chromophore through the handpieces, and we remember it once we're working with lasers. And I just put it here because of these situations that we know a certain handpiece can help and assist a certain situation, like when we choose to go to vascular lasers with scars, we know we're going to target a PIE, which is not a specific vascular lesion, a classic vascular lesion, but we know we can improve it. So these are the edges of the scale that we use lasers and treat them with unique indications. Here we have the differences between intense pulse light and lasers. So with the Alma Harmony, we have both. Of course, we have 5 lasers in comparison to the older versions and other technologies. It's the highest amounts of laser we have on a device. And each one of them works differently, target different chromophore. And with the combination, it's like a new world, because up till today, if we used just once, we had the boundaries of its ability, and we usually went to the highest parameter that we could, and today we're just decreasing and focusing with the combination with other ones. I have to say, with the Alma Harmony, I fell in love with the IPLs. One of my favorite handpieces is the S acne handpiece and the iris acne, and I will explain later how I combine it with the situation of acne. Let's go over. So Alma Harmony. So as I said, for me, it's the new spaceship. I have so many options of choosing different diameters, different strength, different time wavelength. I have so many options, and I'm trying each and every one of them. And I still didn't finish all the options I can do with this device. It's amazing. And I'm working with it almost 1.5 years already. So for those of you who are working with laser, want to take the next step, I think this is the way. So take a look at how many options we have on this platform. So the body itself, it's for preset cooling, but the technology sits inside the handpiece. And as I said, we have 5 different lasers, and on the device in a certain moment, we have 3 different lasers. We have the VascuPen. We have 2 different handpieces that we can connect and actually work with 3 different lasers without changing any handpiece, which is amazing. It's not time consuming. It's really, really comfortable. So I have certain combination that I love to start with once I'm starting a clinic, and I will share with you a few tips next on which of my top 3 combination I really love for rejuvenation. And I think it's not only for rejuvenation, also for the indications. So we have the 5 handpieces on top of it. I'm going to cover it really quickly. We have the VascuPen, which is a 520 nanometer green laser pen that goes to vascular lesions and pigmented superficial lesions. We have the Alma Superb, which is a 2940 nanometer, which is an ablative laser for fractional laser peeling scars and everything that needs resurface, like different skin lesions. Also pigmented ones. We have the Clevas, which is a really strong vascular handpiece, the long pulse Nd:YAG, 1064 nanometers, which is stronger than the other one. All of them are cooled really quickly, and they have so many options inside, and I will show you later the differences. And also Clearskin Pro, which is a winning handpiece for me. I think there is any patient that will go through the door that you cannot treat with clear skin and be valuable treatment. The Clearskin is 1540 nanometer. It's a thermal laser. It makes the skin thicker, coagulative through the skin, and with no downtime, non-ablatively, only erythema, and quite strong. So it's a really good handpiece also for acne. And we have the Clearlift, which is 1064 nanometer Q-switch laser, which is, I think, the best handpiece in this device, which makes pigmentation to be an easy and soluble indication. I mean, it's one of the hardest one, and I find it so effective for situation for even hormonal pigmentation like melasma. And all the rest that we have from the first line and down are handpieces, variations of IPL length that's suitable for different indication between pigmented, vascular lesions, acne, and skin tightening. These are all the handpieces that you see down, the iris ones. I put in the slides clinical combination that you can think of having once you're working with Alma Harmony. So you can see we have, sorry about the sound. So you see here we have
Muito obrigada.
Sorry.
Obrigada. Porque me roubaram o telemóvel. Este é meu, só que no computador não estava. Então estava a tentar entrar e não consigo. Tem a ver com isso. Peço desculpa por isso.
Faz mal.
You're unmuted, us. If you
I'm
can
trying
mute them.
to-
Oh, thank you.
Yeah,
You
I'm
muted
trying.
them. And then you muted yourself. Okay, so what we see here are different clinical situations, skin clinical situation that we can cause with laser. And think about the combination. So we all know clear lift goes through the photoacoustic effect and tear the skin with the on the length of it. And then we have clear skin, which makes it coagulated really deep microthermal zone. And then we have the long pulse, which target the oxyhemoglobin. And then we can also tighten the skin and even target specific superficial pigmented and vascular lesions. And then we can do a different injury inside the skin. We can do it non-ablatively, fractionally, and very deep. And we can do it superficially, ablatively, and non-ablatively. More or less coagulated, we can control on it. And a combination like this is BioBoost for me. When I'm looking at the protocols of BioBoost, I'm thinking about different injury in the skin, different mechanism of wound healing response, and an answer to so many indication. And this is what's unique about the BioBoost. Okay, here also you can see different histologies of the skin from different lasers. Each and every one of them is a different mechanism of wound healing response. We have the Q-switch layers, we have the microthermal coagulative zones of the erbium glass, and we have the ablation, the superficial ablation of erbium glass, of erbium YAG. And the combination of each and every of the three of these makes different mechanism of wound healing response and a synergetic effect. And this is what's unique about the BioBoost. So here you can see different treatments with different lasers. We have, some of them are with volume. So we have the Q switch for pigmentation. We have for different vascular lesions, the long pulse, and we can combine everything on the same treatment. And with the Alma Harmony, everything is stronger, faster, and quicker. So here we can see several of clinical cases, and we will dive into the protocol and tips for the Alma Harmony, treating different indication. And I'll talk about how I think it's will be an effective treatment and what's unique about the new Alma Harmony for these kind of indications. So talking about acne and acne scars, so we have several handpieces targeting this indication. We have, of course, the Clear Skin Pro, which goes coagulated 1540 to the depth of the skin to 350 micrometers inside the skin. And then we can have like a long microthermal zone, which makes the P acne not survive because of the dehydration of the skin. Also, we have it for rejuvenation as well, of course, but this is the mechanism of action through acne. Then we have the Iris SHR for situation of polycystic hormonal situation of young women or postmenopause women. So we can also work with the Iris SHR for hair removal, which solve the situation of hair follicle. Then we can have a combination with also Iris acne, which makes it antibacterial, all the surrounding area. And we can also target PIE, post-inflammatory erythema, with IPLs, with the Iris DiVL or DiSR. It depends on the skin type, because DiVL goes basically to lighter skin and the DiSR goes into darker ones. Both of them are targeting erythema, and the PIE of acne is one of the most successful treatment using the DiVL and DiSR. Also, acne rosacea is also a good indication for the diavial and DSR. And I really love the fact that I can use the in motion mode in a like a manipulation concept. I'm using it in a mode of 1 second and then having like a step above the in motion mode. It's less strong than the stationary mode and stronger than the in motion mode. So it's a really good solution for acne situation and post acne. Remember always that in post acne, we also have PIH in darker skin types. So we can also in skin of color. So we can also use the clear lift. Of course, it depends on what we have there. And of course, all the scars that we will have later. And we can see very good solutions. Once we're talking about acne scars, we need, of course, first to anamnese, and then I really love to combine lasers with subcision, with regenerative medicine and biostimulators. And the reason is that once we're choosing lasers, we're targeting mostly to inflammation and wound healing response. And once we're using regenerative medicine, we are just having like a pass from the M1 macrophage to the M2, from the pro-inflammation macrophage to the pro-healing ones. And then we have like balanced protocol and not a high inflammation or too high inflammation. And this is the best. And also with subcision, we're tearing apart all the abnormal collagen, and then we have a perfect combination of both wound healing response with inflammation and regenerative medicine, which target everything towards healing, collagen, and normalize the skin. So here we can see a very nice case of Dr. Pablo, for mainly PIE and acne scars. Of combination of clear lift and clear skin and iris acne, which is one of my favorite hand pieces. It targets, it's a wide range of nanometers of IPLs, which also makes it antibacterial, and and it's quite superficial. So with combination with clear skin, we're just targeting all the layers of the skin. Another case of acne scars on the vocal area. A really good result of clear lift, clear skin. We can see we don't have it very strong erythema, but the erbium YAG handpiece is so strong. It's like twice stronger than everything we know. So we can see a very good change in this 3 combination. And on the second, it's the second side of the cheek. Again, this one, and another very serious case of acne, of PIE, and a very good result. So clear skin, iris acne, and clear lift gives a perfect solution for post-acne situations. This is a very good freedom of the BioBoost concept. Pigmentation. Pigmentation is one of the indications that is really hard to solve. And here we can see a really good improvement, which causes by the clear lift, because the clear lift is stronger, twice stronger than what we knew. We knew the pulse width was 20 nanometer in the former Harmony XL Pro, and now we have 10. We have it cooled and we have it stronger. So we're targeting much stronger the pigmented area. And here in the photo, you can see a nice diminish of the pigment, and also using with the 532 KDP, which is superficial, but Q-switch superficial. So it's also suitable for situation of melasma. I'm not using it at the first treatments, but I allow myself after several treatments with combination with topicals to use also KDP with great results as well. Again, a case of pigmentation, mainly solar and 8 spots, with a combination of clear skin, which tightens the skin, makes it thicker, and resurfacing with the superb on top of it. And of course, the IVL to reduce also pigmentation and vascular component of the skin. This is also a case of Pablo. And the hand indication. So the back of the hands suffer from aging and sun exposure and photoaging. And sometimes when I see patients with a very good treated face and neck, and then they're talking with me and showing me their hands, I put their focus on their hand and just mentioning, you should treat your hands as well, so it wouldn't be late. So of course, also in this situation of pigmented and skin and age spots, lasers are the main solution. But remember always that we can combine it with injectables as well to give the skin volume and to make the hands look better. So here we have combination of clear skin in order to have a thicker skin with coagulation, a IVL treating the pigmented area, although we can choose in these kind of cases also the Diastar, which I really love for pigmented lesions. And on top of it, the Superb. It's a 4 weeks sessions interval after 3 treatments and amazing results. And under eye is one of the hardest indications. It's an ethnic color. It's in skin of colors we see it mostly. And Clear Lift Pro works amazingly on this indication. Of course, use inner eye shield once you treat, and also the upper eyelid is also a great indication for this kind of combination. I really love to combine the two of the Clear Lift together with the Superb in this situation. Just prepare your patient for a little bit of downtime, because this area is not, I mean, it's an edema area. It doesn't dissolve quickly. Sometimes they have like 3 days of swallow eyes and uncomfortable situation, but once you go really strong, but then it really goes down and the results are amazing. It's really worth it. And here, of course, pigmented scars, we can do resurfacing and brightening of the pigment, and to use also the Diastar if we want to target the PIH. Sometimes the PIH is also on the peripheric area, and I really like to work on combination between in motion technique to stationary mode. So I do everything with the in motion technique, and on top of it, I'm using the stationary mode specific on the scar itself, on the concentrated area. Seborrheic keratosis, a very easy, quick, successful indication for this Superb. I love to work with higher pulse width once we have a thicker lesion with this kind of situation. Really quick, sometimes even 1 treatment enough. It depends on the lesion, but the results are really good. And when we're talking about BioBoost, we need to understand first what is the concept. So the concept of BioBoost is treating biostimulation situation through combination of lasers, but not only lasers. Of course, when we talk about BioBoost, we always think that we can also combine it with other topicals, because using, let's say, erbium YAG, we are creating channels. Laser assisted drug delivery concept is really suitable for these kind of channels. So we need to think what we want to put through these channels. And the best thing would be mesotherapy, exosomes, polynucleotide, everything that causes regenerative medicine, because then we are targeting the wound healing response towards the pro-healing macrophage in the wound healing mechanism. So here we have a different combination for different indication, because the BioBoost concepts meets are in the clinic for every patient. We always need to put in our mind that it's always better to have 2 than only 1 laser, because then we have another mechanism of wound healing response. So for rejuvenation, the classic one would be the Clear Lift and Clear Skin. But if you ask me, in my hand, I always add the Superb on top of it. The Superb is so unique in the Alma Harmony that I can do it so gently, and so even on teenagers that have active acne and areas with scars, I can use the Superb and have a resurfacing of the skin on top of it. And also for aged skin, I can do it stronger and give them a hard downtime. So I always love to combine the 3 of them, the Clear Lift, Clear Skin, and erbium YAG. For pigmentation, we can use the 3 of Clear Lift, Clear Skin, IVL or SR, it depends on the skin type. And also, if it's not a melasma situation, please consider to add the erbium. And you might be you need to change your target. I mean, if the pigmentation is more of a melasma, then I would not go to the clear skin in the first treatments. I would go only to the clear lift without using dye and without using the clear skin, because heat might make the pigment float. So we use only clear skin and cooling, and then in maybe in the fifth treatment at the end of once it's normalized the melasma, then we can also add maybe KTP or erbium, depends. For other pigmentation like solar and age, we can use this rhythm and have an amazing results. For acne, so the three of clear lift, clear skin, iris acne, targeting everything. Targeting the PIH, the PIE, and of course the surrounding area of the lesions. For vascularity, we have so many options in the device that sometimes once physicians are asking me, do you have a device for vascular lesions? So I'm targeting them to the Harmony, and then they have add-ons. They have so many options on top of it, because we have the Clear Vas, we have the DiVL, we have the VLPL as well. We have the DISL, which also target for darkened skin type, also superficial vascular lesions. And we have the VascuPen, which is amazing. I just want to have a word about the VascuPen. I also love to work with the VascuPen, not only on the directed spot, in motion technique on top of it with the 2 millimeter spot. I'm just going on top of the skin in motion. In situation of rosacea, of PIE, it works amazingly. For skin laxity, I love the combination of Clear Lift and Near. And sometimes I love to add on top of it, of course, the erbium YAG. And of course, for rejuvenation, also the Freedom. Just remember, once you're adding an ablative handpiece to these non-ablative handpieces, you make the patient to have a certain downtime. I feel that in my hands, that once I'm having a certain downtime, even a very gentle one, which the erbium YAG also delivers, it's not only just a strong peeling, it's also a very gentle one, the patient feels that he has done something really meaningful for his skin. And I really love to add on top of it, almost every treatment I do, the erbium YAG very gently as well. So here we have the video summarizing the BioBoost concept. So let's watch.
We cannot hear it.
Oh, you cannot hear it? Okay, sorry.
Okay, never mind.
Yeah,
It's okay,
it's okay. Yeah, I'm going on. It was very short, but just for you to understand, it's just a short videos for starting talking about the protocols of BioBoost. So here we have numbers for those of you who are already working, but I understand you have different levels here in the webinar. So I will cover it really quickly and talk just about the important thing of the combination. So once we combine Clear Lift, we can also combine it with Clear Skin in different levels. We can work, of course, with different skin layers and with different spacers with the Clear Lift, targeting different depth of the skin and changing the energy that we're collecting. And then we can do with Clear Skin as well. We can work both with the pixel and with the CVD tip, which is the focal one, changing his diameter. So it depends on what we see on the skin and how we combine it. And the most common question that I've been asked is, with what should I start? Should I start with the Clear Lift with a photoacoustic effect, or should I start with the Clear Skin? So I will summarize my opinion. So it depends on the anamnesis. Once the patient's lying on the bed is an aged one and the focus goes on rejuvenation, then I would start with a Clear Skin, having a serious treatment with the certain tips, also pixel and focus, and combining them. Wait, have a relaxation time of the tissue, and then treating with a Clear Lift. And then we can change it. If we have a pigmented patient, then we will start to focus on Clear Lift, and then on top of it, giving it a lighter treatment of the Clear Skin. So the focus is changing, and then we need to choose if we start with the Clear Lift or the Clear Skin. Here we can see a result, a very nice result of the BioBoost treatment combination of the non-ablative handpieces. So we see a certain erythema immediately after, which really quick resolved after 60 minutes, just a very short one. Of course, if we will be stronger, it will be even longer time. With redness, it depends on the energy that we will accumulate during the treatment. Another case, a very interesting case, is this combination. If you will look at the pores, you will see improvement also in the pores. And this is an advantage of the clear skin, which I really, really admire. Another indication for this combination is the lips. The lips is a very, for some of the patients, they're really afraid of having treatment in the lips and changing the way it looks. So Clear Lift and Clear Skin just gives it exactly what it needs. A little bit of fresh, a little bit of redness, everything improves. It gives it hydration once it's resolved, and a little bit of swallow, just a little bit, not something too exaggerate. So here we have combination of Clear Lift and Clear Skin, and also remember that you can treat lips. Here you can see differences in the combination, in the pigmentation, and pigmentation is a really serious word of indication. So we need to first anamnese if we're talking about solar lenticels or 8 spots or PIH, and differ it from melasma situations. So once we're talking about solar and age and also PIH, we need to remember and look at the anamnese. So solar lenticels are usually quite superficial, so we can use both combination of Clear Lift with Pixel and Focus and then go to the KTP, or taking IPL, the Iris, the IVL or DISR, just having few treatments, maybe 2, and then we're done with solar. PIH usually is quite superficial as well. It depends how old it is, because sometimes when we have a weak basal membrane, then the PIH will be deeper. It will go deeper, even up to reticular dermis, and then we need to combine both Clear Lift, KTP, or Clear Lift with the IPLs as well. So let's have like a rejuvenation pigmentation treatment, I also combine with Clear Skin. And you need to remember that once you have melasma, I prefer not to use Clear Skin, although the coagulation sometimes reduces situation of melasma if we work with low energy. It's not my first choice, I have to say, from my experience. So here we have a situation of melasma. You can see on the forehead, it's a symmetrical pigmentation on both sides, and then we can combine Clear Lift and Clear Skin. Of course, Clear Skin in low energies, and DISR, it's not my first choice for this, but this is a work of Pablo, with an amazing result this time. Always remember that once you have melasma, you need to combine topicals, active topicals for that. And if you choose to work with the SSR, with the DISR, then use the motion mode, which is weaker, and not at the first treatment. The other side, usually one of the sides is stronger than the other. You can see that she has a brow tattoo. The KTP might help in this situation. Another pigmentation case, a bright skin this time, and the Clear Lift and Clear Skin works amazingly with the DISR, and she's mostly have vascular component than pigmented one. Then I think this might cause a very good improvement in this case. Again, solar lenticels together with texture and laxity. And here you can see another combination with the DISR and Clear Lift. And I have to say that for me, the winning BioBoost protocol is to use the combination of Clear Lift and Erbium YAG on top of it. I find it, first of all, the results are amazing, and they feel a certain time, so are committed to the treatment. And after 3 treatments, the results are really changeable and visible. Here you can see a seb care, again with Clear Lift, VLPL on top of it. What I would choose here is the Erbium YAG, but an amazing results. Clear lift, clear skin, and dye veil, also a combination of BioBoost, a winning one. I would say that once we have brighter with erythema, pinkish color, I would go to the dye veil, clear skin, clear lift. And once I have more darker skin of color, pigmented, rejuvenated one, I would go to the clear lift, KTP, Herbimia combination. And you can see here the results. And of course, for acne, the winning one, I told you at the beginning of the presentation, my choice of combination is the clear skin with the iris acne and also with the Vascupen for the PIEs. And if we have also PIH, so I choose the clear lift. And here you can see some of the amazing results of this combination. The iris acne is a really unique handpiece that gives a jump in the solutions that we didn't have for the Harmony XL Pro. So we have it now, and it's an amazing handpiece. Scars again. I have to say that in this situation, remember that subcision is really helpful as well. Number of sessions, 3 sessions, and results are speaking for themselves. Combination of handpiece. So we know now today that combinations of lasers is really helpful and useful. And you can work with it and try to combine it with different levels according to the anamnesis. Let's move to another indication, to the vascular one. So as I said, sometimes I think about the Alma Harmony as a vascular device because it has so many solutions for vascular situation. We have the strong clear vas, which can be really deep and can be really superficial. It depends on the diameter we choose. We can work with the iris dye veil or VLPL and the Vascupen, of course, and the combination of the 3 of them gives an amazing solution for situation of vascular component between also rosacea, sometimes even for Demodex patient. We give them after they finish the course of the medications, we give them, and it really gives a relief in the symptoms. So here you can see for rosacea, dye VL, clear vas, the combination of components, also for non-specific erythema as well, or situation like poikiloderma as well. Here you can see also in the surrounding area, Vascupen, really effective. And here you can see on the filters, the pigmentation and vascularity, and the winning protocol for glow, for rejuvenation for me. So here you can see a combination of iris, clear lift, and near. And for me, I would add it on top of it, of course, there is surfacing. Remember that you have such an amazing tool on the Alma Harmony, use it. So you can see more results and more interesting cases. So here we have some unique cases. This patient was my patient. She's 45 years old. She had a trigger of melasma. I think the stress and the situation was, she was in a very stressful situation and it caused the melasma to float on her skin. And we started with a Q switch alone, only Q switch, because we didn't want to target it with heat. And we used not only the cooling of the handpiece, also ice on the treatment. We didn't accumulate energy. We just used the function of clear lift, of having a photoacoustic effect towards the pigment in different level. And then we had at home active ingredient, alpha-arbutin, vitamin C, azelaic acid, lactic acid. She wore the creams around a month, and then she came for another treatment. And this was after the first treatment. So it's only one treatment, 6 weeks apart, 1.5 months after we treated her. And the melasma just had a regression, an amazing regression, and she succeeded to keep it for longer time. Scars. I think one of the best protocols for the BioBoost combination is treating scars. So here you can see a surgical scar. We treated only with one treatment. Usually we promise for our patient just to have in between 3 to 6, especially with scars. So this patient, we combined clear skin, clear lift, and Herbimia. And then and we injected also profiler body for the skin laxity on the on top of the belly button. And then after 1.5 months, she came for another for a demo and a workshop. And then we just saw we don't have what to treat. The scar almost gone, the erythema, the pigmented area, and everything seems really tight and neat. So very good results. And here we see a traumatic scar, a facial traumatic scar after sutures, after an accident. And we treated with the Q switch very, very carefully, step by step, one shot at a time, because we didn't know what she has, which kind of traumatic substance she had under a scar, under a facial scar, if it's asphalt, if it's a road, if it's even something explosives, we didn't know. So we started step by step, shoot by shoot of the laser. And then everything got swallowed. With antibiotics, we waited in between 2 weeks to 1 month in between sessions. And after, let's say, something like 6 treatments, it's what you see here, an amazing improvement in the scar. So usually the number of treatment once we combine is 3. But always remember that as long as you're using higher energies with a longer downtime, you don't need the 4th and even the 3. So you can control the energies and control the treatment. And remember, I mean, sometimes we choose to work harder with a longer downtime, but it's not necessarily the right choice for the patient, not because he cannot have downtime. Sometimes the results are building themselves step by step. So remember always that the recommended one is 3, but you can also, if you're combining injectables, sometimes even after 2, you will see a good result. And of course, everything is literature-based. All the hand pieces of the Alma Harmony gives us really we have the responsibility to give you the evidence base, and it's really helpful to know that you're working with devices that has so many literature around it. And it's also won an awards, the concept of BioBoost. And I have to say that it started here in Israel, so it's really exciting to know that the first protocol was in my hand, and now everyone is just working with it, and it's an amazing feeling, and I'm really honored to be part of it. And we don't have a sound in the videos for a reason, but maybe just because she has a really nice glass. לא שומעים, נכון, הדס?
No.
Okay, so it's really nice glasses. So for the ending, this is for you. And I hope
in the social media.
Yeah, you can find it on the social media. If you would like us to share with you the videos, of course we will. And that's it. I want to say thank you for you to listen. And if you have any questions, I'm here to answer, of course.
Yeah, we have like 13 minutes. So first of all, thank you very much, Dr. Litzel, for providing us this amazing knowledge and sharing your experience. This is an open conversation, of course. So please, doctors, feel free to ask any kind of questions that you may have. I will start with the first question, if it's okay. It's not
Sure.
It's not related more to the clinical aspect. I would like to know if you can share from your experience, since you're working with the Harmony family so many years. Share with us what is the big difference between the Harmony XL Pro Special Edition to the Alma Harmony.
I have to say that I feel once you're a laser expert, once you're going a level up in your working, you're not working according to a protocol. I mean, with the former devices, we trained physician to work with a protocol, and you didn't have so many options. And today I can do in one treatment, changing sometimes 4 times just the diameters of one laser. Think how many treatments I'm doing just in one time, and how valuable it for the patient. And of course, you need to educate yourself to understand exactly what each diameter does to the patient. And this is what you are doing with experience and learning and working with the device. But I mean, I feel that with this device, I'm cooking. You know, I'm just putting a little bit of everything. And with the former devices, we went through rule of thumbs, protocols, and I think it's a new era for lasers. Each lasers is stronger, quicker, with cooling, different diameters. I think other competitors will take so long to get to this kind of level of lasers. And I'm working with lasers for 10 years. So I hope I answered.
Yeah. Thank you very much.
As you see, I'm really enthusiastic from this device. Really,
No.
It's my
Same with
spaceship.
me. Same with me. I'm Harmony girl. Everybody knows that.
Yeah.
Ariana, first of all, Ariana, as you know, Lee, she's my my amazing partner for Portugal and also the clinical trainer at the company. So please, Ariana, if you have some questions to ask Dr. Lee, this is the time.
First and foremost, I would like to, in the name of all the participants from Portugal, to thank Dr. Lee for sharing with us all these amazing protocols and the concept of BioBoost. I would also like to connect this with the concept and the challenge I think that Alma has posed to the whole Alma community all over the world, which is the 10 years of damage in one session. So how do you feel that, or do you feel that the BioBoost is the answer to get rid of 10 years of damage in just one session?
I have to say, it really depends. I mean, sometimes, and you know, it has a lot with the feeling of the patient. I mean, once you're talking with them and understand with fitting of expectation exactly what's bothering your patient, you will solve not 10 years, you will solve 15 and 20 years as well. I mean, it's all a matter of seeing your patient. I mean, we need to remember, I always remind myself, I'm a person treating persons. So once you understand exactly what you're looking at the treatment, you need to understand the problem, what's bothering him, then you can treat more than 10 years in a minute, really. This is from my experience.
It's very ambitious.
Yeah, but I mean, you can have that if you are targeting exactly what's bothering him. Sometimes it can be a lesion that in 2 minutes you will remove it from the middle of the face and you change his life. I mean, sometimes the scar was so bothering and so emotional for this person, and you in one treatment just improve it and gives them a new life. I mean, this is what I love about BioBoost and the concept of combinations.
Thank you. And I'm going to go for another one before I let anybody else place a question. Many times, and you've showed us a lot of protocols that use 3-4 combinations, and many times with lasers and the IPLs. So one of the things that many clinicians ask me is isn't the IPL a little bit too aggressive to work in conjunction with the lasers, and how does the Alma technology get rid of this danger?
This is a good question.
Yeah, very good question. So we are lucky to have 2 models in our IPLs. We have the dye SR, dye SSR, we have the dye SVL, we have the dye VL. And then we also have the step above it. We can do with the in motion mode, a kind of a stationary mode in the middle. I mean, to work with 1 second to put the whole energy of, let's say, 4 kilojoule inside, and then we're just in the middle. So we have 3 different levels of using. So on top of laser, usually I would go down to the in motion mode, of course, but it depends on the situation of the skin. And it also goes together with lasers. But remember, once you're targeting with heating technologies, just have relaxation time of the tissue. Wait a little bit, cool the skin down. Then you can do another thermal technology with no problem, because you waited and you just make the temperature to be calmer.
Thank you so much. Actually, the skin relaxation time, I think it's something that many times gets overlooked, and people just want to get in and out of the office in 20-30 minutes, and it's just shoot, and that brings complications.
Oh, wait, please wait. The results are better. The patient feels better. And you can go with higher energies once you're waiting, so you will have even better results. So you should do that.
Ok, thank you. Alguém do público que queira colocar alguma questão, podem também escrever no chat. I think everybody's
Guys,
a little
don't
bit
be
shy.
Don't be shy. This is your moment. This is a private session. It started as a private session, of course, for the Portuguese doctors. Although we have here my great partner from Norway, Thomas, and additional doctor, I think, from Bulgaria, but still,
So it's like a
feel free to
three-country,
open the camera,
Yeah.
turn off the mute option, and ask questions. I'm sure that you have questions.
So for those of you who are bothering and have some questions and thoughts of having this device, please feel free also to connect me through Ariana and Adas and ask any questions with regards to protocol, with regards to energies, and of course about the device itself.
Dr. Lee, I think you were so clear and and the presentation was so to the point that nobody has questions at this
For
moment.
sure.
Thank you.
Yeah.
You're welcome.
Okay, amazing. So thank you, Thomas. Thomas
you.
said, thank you and great presentation.
Thank you.
I wish you a great weekend and a lovely evening. And thank you very much, Ariana. Thank you very much for all the Portuguese doctors that attend to this webinar. Thank you, Dr. Litsu, for sharing your experience.
Thank you.
And we will see each other next year at the next webinar regarding the Alma hybrid. We are looking forward. And that's it.
And Happy New Year for everyone.
Yeah, no, of course, Merry Christmas.
Merry Christmas first and then Happy New Year.
Yeah.
Thank you so much.
Thank you.
E obrigado também a todos os que participaram e que assistiram e esperamos que tenham gostado e que se juntem a nós também da próxima vez que houver um webinar. Obrigada.
Obrigada.
Bye bye. Have a nice evening.
Bye.
Bye bye.